So there are a few different treatments for cancer. I'm sure you'll have heard of a few. The first one is chemotherapy, which is the use of drugs. I don't know why it says drugs there, but it is definitely drugs to destroy the cancer cells. There's also radiation therapy, which uses high doses of radiation to the cancer cells and kills them. There's surgery to remove the tumours, so the masses of cancerous cells. You can have a bone marrow transplant, which is also called a stem cell transplant, to replace the damaged cells with healthy ones. Usually before you go through a bone marrow transplant, you undergo chemotherapy as well to sort of reduce the size. There's also hormone therapy, because some hormones can affect the growth of cancer cells. There's targeted drug, I don't know why it keeps saying drug, but it's drug therapy, which focuses on specific abnormalities within a cancer cell that allow them to do this proliferation, targets them, stops it, and then it can't proliferate as much. There's also clinical trials, which are very specific to one person. There's immunotherapy, which uses our own immune system to target the cancer cells. This is very good because all the others sort of like destroy the cancer, but they also destroy the normal cells. But targeted immunotherapy doesn't kill the healthy cells. So, for immunotherapy, it basically amplifies our own immune system to recognise and destroy the cancerous cells. Because cancer cells are actually self cells, the immune system doesn't recognise them as foreign. So to help the immune system recognise them as bad things, you can do activation immunotherapies, which stimulate the immune system to work harder, or suppression immunotherapies, which reduce or suppress the immune system. There are about 4 main ways that you can use immunotherapy that I'm going to go through. The first one being monoclonal antibodies. These are antibodies that are made in a lab. They're basically clones of each other. They tend to be monospecific and bivalent molecules that consist of 2 key regions. So you have your variable region, which is the FAB bit, that can bind to the antigen on the cancer cells, and then a constant region, which is the FC bit, that can bind to the immune cells. They have 3 basic modes of action when they bind. So there's naked, which is the attach to and block the antigens on the cancer cells. There's antibody drug conjugates, so these are chemotherapy drugs that are attached to these antibodies. So when they bind to the cancer cell, they have like a drug with them as well that can destroy them. So it's more targeted than just general chemotherapy, because it's specific to the cancer cell and it doesn't affect the other healthy cells. There's also bispecific antibodies, which contain 2 different variable FAB regions, so it can bind to 2 different cancer cells at once. A second type of immunotherapy are cancer vaccines. There are 2 main types. You have a preventative vaccine that's given to healthy people to prevent things such as infection resulting in cancer, and it also alerts the immune system to any infection so that it doesn't develop into cancer. And there's also therapeutic vaccines, which are given to patients with a cancer diagnosis. It helps to boost the immune system and provide anti-tumour memory. And then here's an example of one. Another one which I'll just throw on that's done with clinical trials is personalised vaccines. So these are very specific to one person, and they're developed from like a biopsy of the tumour. The third type of immunotherapy is adoptive immunotherapies or cellular immunotherapy. These are immune cells that fight cancer cells in 2 main ways. So first, you can either have your immune cells be isolated, so taken out of you, expanded, so made more of, and then put back into you, so you have more immune cells to fight the cancer. Another way is to take out your immune cells, genetically modify them so that they're better at fighting cancer, and then re-put them back in you so they can fight the cancer better. Here's just a bit more information. So you can either have tumour infiltrating lymphocyte therapy. That's when your T cells are already activated by the cancer. You take them out, make more of them and put them back in so that they're enhanced in fighting the tumour. Or you can have engineered T cell receptor therapy, which is personalised to you. Again, you take out your T cells, but these T cells haven't been able to recognise the cancer as foreign. You equip them with a new T cell receptor that is specific to the cancer cell antigen, make more of them, put them back in, and then they can attack that cancer. There's also CAR T cell therapy. These are like sort of a synthetic receptor that binds to a cancer cell, even if it doesn't have any antigens to recognise as foreign. And the final type of immunotherapy are immunomodulators. So these modulate the activity of the immune system and either stimulate or suppress it. They can do this through cytokines and interferons.